In this video, I will discuss about hyperlipidemia. Well, hyperlipidemia or high cholesterol refers to elevated levels of fats in the blood. Most people do not usually experience any symptoms, but having hyperlipidemia increases the risk of developing heart disease and increases the risk of stroke and death. Earlier, I posted a short video about hyperlipidemia on this channel, and today I am going to discuss this in detail. Well, hyperlipidemia means there is too much cholesterol in the blood. Cholesterol is a waxy fat molecule that the liver produces. It is essential for healthy cell membranes, brain functioning, hormone production, and vitamin storage. There are two types of proteins or lipoproteins that transport cholesterol to the cells. Low density lipoproteins LDL are bad cholesterol, and high density lipoprotein HDL are good cholesterol. LDL has damaging effects on health. HDL, however, counteracts the effects of LDL. HDL is good for health as it carries excess cholesterol back to the liver for excretion. The liver then eliminates cholesterol through bile. LDL that remains in the bloodstream damages health because it allows excess cholesterol to build up in the blood. Triglycerides are another type of fat in the blood. They are not a type of cholesterol but have a strong association with heart disease. As such, doctors also measure triglycerides levels in people with hyperlipidemia. Now I will tell you the symptoms of hyperlipidemia. Well, usually people with hyperlipidemia do not experience any symptoms. However, those with familial or inherited hyperlipidemia may develop yellow fatty growths around the eyes or joints. A doctor usually detects hyperlipidemia during a routine blood test or following a cardiovascular event such as heart attack or stroke. An excessive buildup of fat that over time can cause atherosclerosis. This is when plaques develop on the walls of arteries and blood vessels and narrow the opening. This can lead to unstable blood flow through the vessels and can greatly increase the risk of heart disease and stroke. Now I will discuss some preventive measures of hyperlipidemia. Well, lifestyle and dietary options are an important way to prevent and treat hyperlipidemia. Options include eating a heart-healthy diet, taking regular exercise, not smoking, and maintaining a healthy body weight. Regarding diet, a healthy diet includes minimizing the intake of saturated fats, trans fats, and dietary cholesterol, and consuming a variety of whole fruits and vegetables, plenty of fiber, lots of water, and whole grain foods. People should try to restrict or eliminate fast foods, high carbohydrates food, and any processed foods or foods that do not offer good nutritional value. Fish, nuts, and legumes contain healthful fats, so can provide benefits for people who need to reduce their LDL cholesterol levels. When using oil, choose olive oil or another oil rich in monounsaturated fats. Now I'll discuss something regarding weight. Well, people who are overweight or have obesity are also at greater risk of developing hyperlipidemia and heart disease. Losing weight can help a person reduce LDL, total cholesterol, and triglyceride levels. It can also boost HDL, which helps to remove the LDL from the blood. Physical activity. A lack of physical activity is another risk factor for heart disease. Regular exercise and actively help a person reduce LDL, raise HDL, and encourages weight loss. Now I will discuss the role of smoking in hyperlipidemia. Well, smoking triggers many problems that contribute to heart disease. It promotes atherosclerosis, increases LDL levels, and encourages inflammation and the formation of blood clots. Quitting smoking will result in higher HDL levels. This may be one reason why the risk of cardiovascular disease decreases after a person stops smoking. A person with hyperlipidemia can reduce the risk of cardiovascular problems later in life by strictly following the diet and treatment plan recommended by their doctors. Now I will discuss the treatment of hyperlipidemia. Well, self-management of hyperlipidemia through a balanced diet and regular physical activity, as I told you before, may help a person reduce levels of lipoproteins in their blood. However, genetics also determine cholesterol levels, so a healthy lifestyle may not always be enough to reduce cholesterol. Some individuals may require medications. Typically, doctors prescribe statins such as simvastatin, lovastatin, atorvastatin and rosuvastatin for reducing cholesterol. These medications decrease the amount of cholesterol and the liver produces. Statins can cause side effects including muscle pain. The muscle pain is usually harmless, but in rare cases statin can cause muscle damage or breakdown. Anyone who finds the pain hard to tolerate should talk to their doctor before stopping taking the drug. It is essential to balance the risk of a cardiovascular event against the risk of side effects before stopping treatment with statins. People whose cholesterol levels do not reach their desired target after taking statins may need higher doses of statin medications or additional medications. Other non-statin medications include ezetimibe and less commonly fibrates or niacin. New guidelines suggest PCSK9 inhibitors are also available, such as evolocumab that comes with the name of Repatha. PCSK9 inhibitors can be expensive, so a doctor should take this into account before prescribing them. However, the guidelines recommend a lower price for those medications to allow specific population access to the drug. Now I'll discuss about the diagnosis. Well, doctors screen for hyperlipidemia using a lipid profile blood test. Well, it is usually a fasting test. This means that a person should refrain from eating or drinking anything for 9 to 12 hours before the test. However, new guidelines are less strict about fasting, so check with your doctor whether you need to fast before the test. You can drink water. Let's say if you go to a lab for test and the test is scheduled at 9 a.m., then you should not eat any food at 9 p.m. on the last day. It should be around 12 hours of fasting, but you can drink water, okay? A recent guideline update revised that parents can choose for their children to have a cholesterol screening from 2 years of age if they have a family history of high cholesterol or heart disease. Most children should undergo a screening between 9 to 11 years of age and 17 to 21 years of age. Now I will discuss the causes. The causes of hyperlipidemia include genetic factor. Doctors refer to this as primary hyperlipidemia. A person inherits this type from their parents. Poor diet and other factors. Doctors refer to this as secondary hyperlipidemia. Other risk factors include excessive alcohol consumption, obesity, taking medications such as hormones or steroids, diabetes, metabolic syndrome, long-term kidney disease, premature menopause, and underactive thyroid gland or hypothyroidism. Also, in pregnancy, your lipids can be high, and if you have a sedentary lifestyle, then that can also lead to hyperlipidemia. Familial hyperlipidemia stems from a genetic disorder. A parent passes down a mutated gene that leads to a missing or malfunctioning LDL receptor. This means that the body cannot clear LDL from the bloodstream, which can result in dangerous levels of LDL in the blood. Well, there are so many types of familial or genetic hyperlipidemia. There is no need to discuss all those types because that will be confusing and the video will be very long, okay? But you need to know that hyperlipidemia is a major risk factor for heart disease. It refers to excess levels of LDL cholesterol and triglycerides in the blood. Doctors consider low density lipoprotein as bad cholesterol and high density lipoprotein HDL as good cholesterol. Hypothyroidism, a high fat diet and being overweight contribute to high cholesterol. However, some types of hyperlipidemia have genetic causes. Regular physical activity and a diet rich in healthy fats can improve the balance of cholesterol in the blood and help a person prevent health problems. Well, this was my video about hyperlipidemia. I hope you will like this video. If you have any question about hyperlipidemia, you can ask me and you can post your question in the comment section. Thanks for watching this video. See you in next video. Bye for now.